A warm good morning to everyone. My name is Chandima. Today I am going to discuss my topic PPH or postpartum hemorrhage. So the word hemorrhage means any escape of blood from any ruptured vessels. So PPH is one of the most causes of maternal morbidity and maternal mortality during the childbirth period. Half of a million women dies due to PPH during the childbirth period. So now the definition: any kind of bleeding from or into the genital tract after the delivery of the baby or following the birth of the baby up to the end of the puerperium is known as PPH. So after the delivery of the baby, bleeding is very normal, but in case of vaginal delivery, if the bleeding exceeds the amount 500 ml, then it will lead to PPH, and in case of cesarean section, if the bleeding exceeds the amount 1000 ml, then it will known as PPH. Now the types of PPH. PPH can be divided into two types. First one is primary PPH and second one is secondary PPH. If the bleeding occurs within the 24 hours of the delivery, then it will be known as primary PPH, and in case of bleeding occurs after the 24 hours of the delivery till the puerperium period, it will known as secondary PPH. Now the scene is, what is puerperium? Puerperium is the period after the delivery of the baby, and when the pelvic organs or the genital organs or the reproductive organs revert back to its original position. This period is known as puerperium. Now the causes of the PPH. So in case of primary PPH, atonicity of the uterus. Atonicity of the uterus means when the uterus is unable to contract or it cannot go back to its original shape and size, then it will known as atonicity of the uterus. Second one is trauma. Any kind of traumatic injury or any kind of accidents is occurring means then it will be lead to PPH. Then next one is mixed, means both the atonicity of the uterus or any type of traumatic injury may lead to PPH. Next one is retained product of the conception. If the mother is going through any surgical procedures like DNC or DNE, or she is having any she is using any contraceptive methods of abortion like this, if there is any product is remaining in the uterus, means it will lead to PPH. Second one is uterine rupture. That means any rupture or any accidental case is going on with the mother, that will lead to excessive bleeding after the delivery and it will lead to PPH. Next one is blood coagulopathy. Blood coagulopathy is a disorder. What happens in this disorder is blood cannot clot properly, and if the blood can clot in proper time, it will lead to excessive bleeding and it will cause PPH or postpartum hemorrhage in a pregnant woman. Now the causes of the secondary PPH. The first one is retained membranes. If any retained products or retained membranes of the placenta or the baby is remaining in the uterus or the womb of the mother, means it will cause many type of infection or it will cause any type of bleeding in mother, and it will cause excessive bleeding. If it is causing excessive bleeding, means it will be known as PPH or postpartum hemorrhage. Now infection. If there is any infection in the genital tract in the mother or any infection in the uterus is mean there will be chances of bleeding. Now the third one is endometritis. Endometritis is known as any type of inflammation or infection in the uterus. If there is any type of inflammation or infection is occurring in the uterus, mean there will be chances of heavy bleeding after the delivery of the mother and it will lead to PPH. Fourth one is hemorrhage during cesarean section. During the cesarean section, if any hemorrhage is going on the if in hemorrhage is occur in the mother or in the genital tract of the mother, means there will be excessive bleeding. Now last one is others. In this, carcinoma of the cervix or fibroids or polyp. In if there is abnormal cell growth or cancerous cell growth in the cervix, or if there is any type of fibroids or polyps is there in the cervix, means there may be chances of heavy bleeding after the delivery of the baby, and it will be one of the most important causes of PPH. After the causes, we will be dealing with the risk factors of the postpartum hemorrhage. So the first one is prolonged third stage of labor. The third stage of labor is also known as placental stage. In this stage, what happens, after the delivery of the baby, the placenta is delivered from the maternal womb or vagina, through the vagina. So if this period, or if the delivery of the placenta is taking longer time than the normal, that means it will be a risk factors of PPH. Next is episiotomy. Episiotomy is a surgical incision we are making in the perineum area of the mother for to make the delivery of the baby more easier. So episiotomy is one of the risk factors of the PPH. Next is fetal macrosomia. Fetal macrosomia means big baby. The size of the baby will be bigger than the normal size. Next is history of PPH. If there is already a history of previous postpartum hemorrhage, means the mother is having high chance of PPH. Next one is grand multipara. Grand multipara means if the woman is having already more than 5 births, it may be live birth or stillbirth, no issue. If the mother is having more than 5 birth, that will be 5 birth of the baby, that is known as grand multipara. Next is placenta previa. Placenta previa, what is placenta previa? Means the implantation of the placenta will be abnormal. That means it will not implanted in the normal position in the uterine wall, rather than it will be implanted in the opening of the cervix. That is a high risk of PPH. Next one is abruptio placenta. Abruptio placenta, what is abruptio placenta? It is basically immature separation of the placenta before the delivery of the baby. The placenta will be separated from the uterine wall before the delivery of the baby, and it will cause a heavy bleeding of the mother. Next one is PIH. That means pregnancy induced hypertension. If the mother is having any kind of hypertensive disorder, like maybe preeclampsia or eclampsia, it will lead to PPH to the mother. Next one is symptoms. What are the symptoms are seen in the PPH? First one is massive blood loss. Massive blood loss means it is visible actually if there will be heavy blood flow from the vagina of the mother. Next one is dizziness. There will be weakness in the mother, and she will feel dizziness. Next one is headache. There will be light headachehness in the mother. Next is decreased blood pressure. There will be decrease in the blood pressure. Increased heart rate. The heart rate will be increased than the normal heart rate. Next one is swelling and pain in the vagina and perineum. There may be swelling, or there may be flush skin around the vagina or perineum area. After that, management. That means how to manage if the mother is having PPH. So the first is medical management. In medical management, we can give the mother oxytocin 20 to 40 units in 500 ml, 500 normal NS. Then is ergometrin 0.25 mg, and the next one is prostaglandin derivatives. The surgical method is hysterectomy. Hysterectomy means partial or the full removal of uterus from the womb of the mother. Next is nursing management or prevention, you can say. In antenatal period, when the mother is coming for antenatal examination, we will try to improve the health of the mother. We will provide a proper diet chart to the mother, so that the health of the mother, the condition of the mother will be improved. we will identify high risk patients. That means we have already learned about the risk factors of the PPH. We will identify what are the high risk patients, and we will give them proper treatment so that we can prevent PPH. Next one is blood grouping. We will take a blood sample and groupify the blood of the mother, so that in case of any emergency we can provide enough blood to the mother. In the intranatal period, or during the time of the delivery, slow delivery, we will suggest slow delivery, because that will reduce the chance of bleeding from the genital area. Or spontaneous separation of the placenta. We will not force the placenta to from the genital tract or from the uterus. We will wait for the spontaneous separation of the placenta. Next one is observation. After the delivery of the placenta, we will observe the mother and the baby, and also the placenta very carefully. If there is any complication is there, means we will use emergency resuscitative management. Thank you.